Good afternoon. Today is Tuesday, November 24th, and I'm Dr. Allison Arwady, the Commissioner at the Chicago Department of Public Health. This is your opportunity to get your COVID questions answered live. You can put them directly into the box below on Facebook. You can also hashtag them on Facebook or Twitter with the hashtag AskDrArwady. We are at a slightly different time today because the budget hearing is ongoing on the mayor's channel, but we've been getting a lot of really good questions in and there's a lot to talk about, so we did want to make sure that we had a chance to answer questions today. So I think let's go ahead and take a look right away at the data. As always, you can go to chi.gov/COVID- to get to our dashboard. Also, if you go to chicago.gov/coronavirus, right up at the top under latest data, you can see a lot of different data. We've continued to add more information there really every few days. So if we go to the main dashboard, first of all, if you look, you see that the colors here are green, and this is because we are seeing some early signs of potential progress. But I want to put this in some perspective. So if we look on this page, first of all, you see that our current positivity is at 13.6%, and that is down, but it is still not good. You see that our tests are breaking records at almost 17,500 per day, the highest they've ever been. And then our cases are at 2,050 on average per day, which again is down from last week, but still not good. 5 times even the upper limit of where we need them to be. And if we switch over to our daily by demographic, you'll see here, particularly if we look at deaths, do you see how deaths here are up to 13 per day on average? That may not sound like that many, but if you think about that, that's more than 80 a week. And unfortunately, where you think over the summer we were seeing 2 to 3 deaths a day, we are now seeing 5 to 6 times that. And unfortunately, hospitalizations are still very much on the rise too. We've got more than 1,100 people being reported today in non-ICU beds and another more than 300 people being reported in ICU beds here in Chicago. And the worry is that of course, I'm pleased to see even the beginnings of some flattening here, but the worry is that especially with Thanksgiving this week, I'm hearing that there's still 50 million Americans who are planning to travel despite the way COVID has been surging across the US. I'm hearing that O'Hare has been breaking records with the numbers of travelers. They haven't seen it since March. I'm really concerned that we may not be able to maintain this little bit of progress that we're seeing. And so just asking everybody to double down, think about those hospitalizations, and unfortunately those death numbers still going up. Before we get into your questions, I did want to show a video. There's a poem that I wrote that the people from the Chicago Department of Public Health read, and it talks a little bit about what we are asking everybody here in Chicago to do. So it's about 3 minutes long, and I'm going to ask the team just to play it. It's on our Facebook page, but in case you missed it, it sums up a little bit of where we are and what we're really asking folks to do. So let's go ahead and play that now if we can. Last spring, we all were largely driven by our fear. We did not have all the answers, but the worry signs were clear.
You rethought the word essential, stockpiled on toilet paper.
We fretted over epi curves
and begged for ventilators.
This summer, we all settled down with COVID in our nation.
We wore our masks and washed our hands and took 2 days vacation.
But now it is November, and the novelty is gone.
The cases are resurging, but our apathy lives on.
Most people do survive.
Can't we just be done with COVID?
Well, we're sorry to inform you that our cases have exploded.
We don't care about your politics, don't care about your views.
Don't care about the channel where you watch your evening news.
Doesn't matter how you voted. We don't care to whom you give. The only thing we care about is, do you want to live?
But not just you, your family, your neighbors, and your friends.
and Chicagoans you've never met, because they all depend
On you to make these choices that help protect us all.
and help protect Chicago from what could be our downfall.
We can't make you wear a mask or watch you wash your hands. We can't make you social distance. You must understand.
We can't draw those 6-foot markings on the floor of every room.
We can't make you shift Thanksgiving onto FaceTime or to Zoom.
We can't force you to stay home if you're starting to feel sick.
We can't postpone every party, every play date, and picnic.
We can't call up all your grandmas, cancel all your Sunday meals.
We can't stop get-togethers. We can only appeal. To every single one of you, please stay home when you can.
Don't have others over and build your COVID plan.
It's not the time to travel, sitting next to folks who cough.
Think twice about your actions. If you can, please put it off.
This isn't forever. We promise in advance.
But right now in Chicago, COVID's grabbing every chance.
And this is how we open, how we bring back things we want.
How we restart social gatherings. How we open restaurants.
How we show our care for others. How our city gets ahead.
How we make sure if you need it, there's a hospital bed.
We want neighborhoods to flourish. We want business to survive.
What's good for you is also what will keep most folks alive.
We're a city of live music and of festivals and of plays.
We're a city made for Insta, and our lakefront goes for days.
We want picnics, parties, nightclubs, Bears, Bulls, Blackhawks.
White Sox, Cubs. We want schools and playgrounds open. We want worship, gyms, and pubs.
But before all these things can happen, we face winter and the flu.
A vaccine will be coming, but for now, it's up to you. All right, so I hope you enjoyed that. I hope you heard the part about shifting Thanksgiving onto FaceTime or to Zoom. That is what I will be doing, and I very much hope it is what really all of you are doing, that you've made changes to your Thanksgiving plans. It's not the time for traveling. It's not the time for having people over. We remain under this stay-at-home advisory here in Chicago. So really you should be staying home except for work or school or things that are essential, like medical care, getting groceries. Let's get into your questions. Okay. Jen D on Facebook says, there seems to be some issues with contact tracing. I know 5 people who are positive in Illinois and not one has been contacted by a tracer. I realize there are more cases than investigators, but for 5 out of 5 not to be contacted seems troublesome. Yes, so what I can say is that really across Illinois, as across most of the country at this point, there are not enough case investigators in particular to handle the huge upsurge of cases that we've seen. And so the CDC has put out guidance about how to prioritize case investigation. And even before that, at the Chicago Department of Public Health, we'd been working to prioritize some of that case investigation. So, just to give you a sense, we've gone from about, 300 cases a day to a couple of days more than 3,000 cases a day just here in Chicago. We did not have, 10 times the number of investigators. And more importantly, we've seen a big upsurge of actual outbreaks and clusters, not surprisingly, associated with this surge. And so our investigators first prioritize investigations into places where we've seen spread, where vulnerable people stay, or where there are outbreaks. And so where we're having, at this point, 300, 350 outbreaks a week, not cases associated with outbreaks, that does tend to be where we start, because people who have been exposed in a setting where we've already seen spread are the ones we most want to make sure are getting contacted and follow up. We've also been putting a lot of extra resources into long-term care facilities, our nursing homes, where we are seeing, again, some increases in cases, into homeless shelters. There's been some work in the jail. There's been some work in other congregate settings, and then just other places where there are the potential for spread is sort of where we start. And so one of the things we're doing is actually using some newer technology platforms to be able to make sure that people who are at an individual level getting diagnosed are getting a faster outreach. Historically, we've worked to call a number of times, and then only if we don't reach somebody do we follow on with more of an automated response. But we're working to build really an automated response so that people who are diagnosed with COVID are able to get, in a way that is secure and protective of their privacy, a link to be able to securely share with the health department some about their own history and even their own contacts if there needs to be help in terms of contacting them, as well as some information about making sure they understand the appropriate time frame for who their contacts would be, and even some guidance for if they're reaching out to their own contacts, and then making sure people are connected to our COVID resource hub. So hopefully, if we're able to see some more significant downturn here, we'll be able to again pick up more of that individual case investigation. But right now, we are prioritizing it. So I would ask, if people are getting a positive test and you're not sure what to do about it, reaching out to your doctor, or to the health department is fine. And we're also increasingly bringing on those same healthcare providers in Chicago. So our federally qualified health centers, some of our hospitals that are doing a lot of testing, we've done some funding there to make sure that as part of calling out the test results, we're getting that initial case investigation contact tracing started much more quickly. So we're certainly working on it in a lot of directions, and I feel good about some of the new things that we're putting in place. But you are right that with this surge of cases, we cannot fully keep up with the numbers. Okay. Some questions here coming in about the vaccine, and we got a number of questions about the vaccine even over the last couple of days. So one of the questions I've heard a couple of times is about this new vaccine. Both the Pfizer and the Moderna vaccine use something called mRNA, and we got some questions about, is this will this vaccine affect my DNA? Like, do I have to be worried about the genetics of this? So you do not. Why don't we maybe just take 1 minute and explain a little bit about how this new kind of vaccine works. Honestly, it'll be probably more like 3 minutes, but it's worth it. So traditional vaccines usually start from a weakened or a killed virus. So you are injecting a portion of an actual virus or a virus that has been killed and cannot make you sick. But the idea is you want to teach your immune system to recognize that virus as an invader and build up an immune response so that when you encounter the real thing, you build that immune response without it ever making you sick. These new mRNA vaccines use a technology that is really pretty cool. It uses the idea that, actually, let's go back to basic biology. When, all of your cells have DNA, right? DNA is your genetic recipe. Every one of your cells has this double-stranded DNA in the nucleus, in the center of the cell, and it carries your whole genetic makeup. What normally happens, not the vaccine, but just in your body, is that the DNA itself does not make anything happen in your body. To make anything happen in your body, the DNA is just the recipe. There's RNA, and specifically mRNA, messenger RNA, that is in the nucleus, in the center of your cell, and it matches up to the DNA, and it takes that recipe, and it literally carries it like a messenger out of the nucleus into what's called the cytoplasm, the rest of the cell. And that little copy of part of the recipe goes to the ribosome, which is the part of your cell that makes proteins. And proteins are actually what make everything happen in your body. Proteins are sort of the actual ways in which your genetic code is expressed. So the idea of a messenger RNA vaccine, an mRNA vaccine, which again is what these two new vaccines are, is that you create a recipe for part of the coronavirus. Not the part that gets anybody sick, but the little spike. You've seen pictures of the coronavirus. Remember, coronavirus means crown, and these spikes are quite specific to the coronavirus, and we don't have those spikes on anything in your own body. So you can create the genetic recipe to make a little spike, and then you actually inject the mRNA, the messenger RNA, that recipe that instead of reading it off your cell's DNA is made, and then it's in the cell, not in the nucleus of the cell. So not in with your DNA. It does not affect your DNA. It does not do anything to your genetic code. There's not a mutation there, nothing like that. It stays outside the nucleus, but it gets taken up by the ribosome, which is the part that makes the protein. And basically that little ribosome takes this mRNA recipe and it churns out little pieces of the crown, of the spike protein, and presents them to your immune system. So your immune system says, oh, I know what this crown looks like. I'm going to build a response. So the next time I ever encounter the coronavirus, the real spike protein, I can protect, Allison against the virus without actually making her sick. So it's a really interesting way of introducing immunity that doesn't depend on injecting live or inactivated or killed virus, so it can't make you sick, and it uses the natural machinery of the cell to produce the immune response. So it's exciting because the fact that this has been shown, at least in the preliminary studies, we're certainly waiting for the FDA to do the formal approval, and there's a meeting scheduled at the moment for December 10 for the first vaccine for the FDA to potentially be talking about this at the meeting. But the fact that it's looked to be as effective and safe as it has is important for the vaccine, but it's actually also important for probably other technology where we could use the same mRNA idea to have your body produce other proteins that you might be lacking or protections for other diseases. So that's how it works broadly, and there's no concern. It never interacts with your DNA. It does not get into the nucleus. It does not genetically mutate in your body or change your own genetic makeup. And part of the reason that the supply chain has been so hard, this minus 80 degrees, is that mRNA is not very stable. So they had to figure out how to put it into these little fat globules that can be injected into the muscle cell. And at least one of those has to be kept very cold so it stays stable. And Gail Waldock from Facebook as a follow-up, injection of a vaccine that is kept at negative 100 degrees is okay, she's asking. And that's right. It's negative sort of 70 to 80 Celsius, and it is more than negative 100 degrees Fahrenheit. It is not injected while it is minus 100 degrees, and that's a really good question. It's kept at that very low temperature to keep the fat molecules stable. But we do defrost it and sort of bring it all the way up to room temperature before we inject it. But the problem is that those little fat globules only stay stable for about 5 days. And so the logistics here are that it needs to be shipped on the very cold, it needs to be stored in the very cold, and then when you defrost it, you've only got about 5 days to use it. You can't put it back in the deep freezer. And so that's where a lot of the really detailed logistic planning is happening with the hospitals and through the health department, because of course our first people who will be offered the vaccine are our hospital-based healthcare workers who are at the highest risk of being exposed to COVID. There's a lot of logistics there to making sure that when we're distributing vaccine, that is all going to be administered within 5 days. So yes, it is okay, and the vaccine will not actually be that cold by the time it is going into anybody's arm. Okay, Tina Grieshaber on Facebook is saying, I live alone, as does my downstairs neighbor. We're both in higher risk groups and we're planning a contactless dish exchange for Thursday. Setting homemade food outside each other's closed doors, never seeing each other. How risky is the dish exchange right now, and would you advise canceling? I think that this is a very good solution to being able to share Thanksgiving. I think sharing dishes is very low risk in this way because it does not involve interaction with living, breathing human beings. We know that COVID is not transmitted in food per se. In the very, very unlikely scenario that you or your neighbor, somebody had COVID and didn't know it, as long as you're washing your hands well, before and after eating, I really have zero concern, honestly, for spread of COVID for a situation like that. I think the ability to share food and leave it for people who may be alone or otherwise not cooking is a very safe way to share some of that Thanksgiving spirit without putting people at risk. So I'm glad to hear that you're doing that, and I encourage you absolutely to do that and to have that safe way of sharing some of this tradition. So thank you for being so careful with your Thanksgiving planning. Diane Red on Facebook is asking, what side effects are there from the vaccine? So again, we don't yet have the formal FDA data. Pfizer was the first vaccine candidate. They just submitted last Friday their formal application to the FDA for emergency use authorization. The FDA right now is looking at this, and then presumably on December 10th, that's when there will be this public meeting, and there are external scientific advisors that are not part of the FDA, not part of the government, who review this information and make a decision about the emergency use authorization. So what we know from what's been shared publicly, like in the media, is very high level, that in both the Moderna and the Pfizer vaccines, which use very similar technology, in the 30,000 people in one of the vaccines, the 44,000 in the other, have not seen serious side effects. What we have seen is complaints of sore arms, and then complaints of people feeling sort of fatigued or a little under the weather, unwell, for about a day, similar to what some people will have after getting other vaccines. It's not that the vaccine is, giving you COVID or giving you flu or giving you whatever, but that actually is your immune system responding to the vaccine and sort of teaching your body, how to respond. But it is premature to be able to talk about that in detail because I've not seen the data. We will be sharing, in extensive detail and working with other scientific advisors, and we'll share in detail this percentage of the placebo group, remember the group that did not get the vaccine, had these side effects. This percentage of the group that got the real vaccine had these side effects. But a vaccine will not be approved if there are signs of, serious side effects that seem to be significantly related to the vaccine. And there will be follow-up after the vaccine is in that emergency use authorization, even after it's approved, to continue to follow people as they are getting vaccine. Because of course, where we're talking about, eventually millions of people getting vaccine, continuing to monitor, understanding any potential side effects will remain very important. This is the same process, the testing of the vaccines that is done for the childhood vaccines. And again, the preliminary data from what we've seen looks very, very good for safety and efficacy. But we will only be able to formally speak to that once we can see the actual data from FDA, but I think that will be really soon, probably mid-December. Okay. At K Stonin on Twitter says, I spent 4 of the past 5 weeks in quarantine because 4 people in my office tested positive. I'm terrified to be at my office. The higher-ups care more about seeing me at my desk. Do you have any suggestions? Okay, so of course I don't know the exact details of your exposure. It sounds like if you've been in quarantine 4 of the past 5 weeks, there were probably multiple exposures as opposed to 4 people testing positive at the same time. Presuming that your office was following the public health guidance, this would have meant that your exposures were not just that you were in the general office, but that you were actually, 15 minutes within 6 feet of somebody. And that would be a real exposure. So I totally understand if you've, where people, and we're seeing this just much more, by the way, right? Whether people are in office settings or any work settings, in school settings, and daycare settings, there is a lot more COVID in Chicago right now, which means there are also just a lot more exposures. So thank you if you were, asked to quarantine because of an exposure. Thank you for taking that seriously and staying home. We really have honestly learned a lot about keeping workplaces safe. And even at the Chicago Department of Public Health, we do not close the CDPH office when we have a case of COVID, and we have had cases of COVID. We make sure that the people who have had that close contact are notified, again, protecting the person's privacy. We will ask those people to quarantine, and we obviously do cleaning where that individual may have been, but there is not a scientifically based reason to need to sort of close the whole office. I, of course, don't know about your underlying conditions because I can tell you there are employers who certainly, and I don't know about your work either. Are you an essential worker? Is it possible to work from home? But broadly, I do want to reassure you that where offices are taking these precautions seriously, and it sounds like your office is, the risk of being at work where people are wearing masks appropriately with the appropriate social distancing, et cetera, is not broadly very high. And so I want to empathize with, where you've repeatedly been asked to quarantine, that's a really worrisome conversation. And I would also, I hope that your employer is offering opportunities for kind of support there around that emotional piece. But if you've been quarantined multiple times and haven't developed symptoms, haven't developed COVID, that is also somewhat reassuring in terms of the protocols it sounds like your employer has in place. So my biggest thing is that anybody who is sick and have symptoms needs to be staying home. And then I know different employers have different things set up for folks who have those underlying conditions. So I think, having those honest conversations with your employer, continuing to ensure that your employer is following that public health guidance. And if there are, significant concerns, it sounds like not so much for your situation, but we have heard of employees being retaliated against, et cetera. You can contact through 311, and the city has made resources available if there are employers who are not appropriate following COVID guidelines. So thanks for that question. Sam Martin from Facebook says, IDPH changed the capacity reporting recently for hospitals. Are the hospital bed capacity numbers on the CDPH website the same as on the IDPH website? Yes. And if you look at both under latest data up at the top of the page on chicago.gov/coronavirus, you'll see we've got the sort of outbreak summary, which includes some hospital data as well as the hospital capacity numbers. And the change that was made, just to be clear about it, was that we asked hospitals not just to tell us about how many beds they had available, but how many beds they have available that they are able to staff, whether those are ICU beds, ventilator, beds that have ventilators, or non-ICU beds, because our biggest concern with the way COVID is surging across the whole country is that staffing is likely to be the rate limiting step when it comes to full hospitals and healthcare systems. And so it's not so much about do you have the capacity to expand more beds if you don't have the staffing capacity. So that was the change. And yes, we use the same system where hospitals every day are reporting in, actually twice a day right now, are reporting in their numbers of COVID diagnosed patients, what are called COVID persons under investigation, meaning people who clinically likely have COVID, but we're waiting on a test result, as well as people who don't have COVID but are taking up hospital beds. And so that is all reported in and then shared out on the website. We at the health department do track every individual hospital as well, so we know what the capacity looks like, but we report out in aggregate what it looks like at the system level on the website. So encourage you to explore that. I look at this every day. We report this to the mayor every day, and certainly we're continuing to see those cases rise, although still not quite to the level that we saw here in Chicago back in May, compared to the rest of the state, where they have long since broken the hospitalization records compared to what was seen early on. So the concern is they're still going up, and the hope is that if we can hold on to this very early progress and see real flattening in the cases, later that will be projected, that will show up in hospitalizations, ICUs, and then eventually deaths. But unfortunately, those numbers are still going up right now. Okay. Pamela Straitman from Facebook, how risky are visits to the doctor at this time? First, I like the way you asked that question. Usually people ask, is it safe? And there is no such thing as safe or not safe. But in terms of how risky are visits to the doctor, again, there's been a lot of work to make healthcare settings as safe really as they can be. I generally fall pretty strongly at this point that going to the doctor and getting the medical care that is needed outweighs the potential risk of COVID. There's been a lot of work related to screening, testing where it's indicated, really making sure that people are not coming to the doctor. You're not mixing patients who might have COVID with patients who don't have COVID. A lot of attention to that. And there are studies that have been done that have been shown, in healthcare settings, low risk of transmission within those settings. So I worry more at this point, honestly, about people who may be putting off needed medical care. We certainly have seen childhood vaccines way down. We've seen things like mammograms and pap smears and colon cancer screening way down. Of course, if you have a serious underlying condition or you're otherwise having to be really careful about exposure, that should be a conversation you have with your doctor about what those risks are. But for the general Chicagoan, I think generally going to the doctor but being really careful about the ways that you do that is the way to go, and talk to your doctor if you have specific questions. All right, Audrey Fisher on Facebook says, research suggests that melatonin could be helpful as a preventive and adjunct treatment, as well as follow-up care for COVID. Why isn't it discussed more? Okay, Audrey, so melatonin is an example. For people who don't know, melatonin is a sleep aid that people will use. It's available over the counter. It's thought to be one of the more natural ways that works for some people to help regulate sleep patterns. So where this came from, at least my awareness of it, is that the Cleveland Clinic fairly recently they're looking at what's called big data, where instead of looking at each individual patient, you look at for any potential patterns within the tens of thousands of patients who are seen across the system. And there's been a lot of work to look at drugs that are already approved by the FDA or things that are available, not just melatonin, but some of the vitamins, right? Vitamin A and D and E and C, and then to actually do studies to see, are these effective? So Cleveland Clinic had published some information the other week showing that it seemed that in the high-level patterns, perhaps people who had had COVID were less likely to be taking melatonin than the people who had not. But this is not a study, this is not a head-to-head comparison, and so they were going to be doing a very small early trial just with 30 people in it, where some of the people get melatonin, some of the people don't with COVID, and you see if it makes a difference. And there's like a long way to go in terms of setting up actual placebo-controlled, randomized controlled trials. So the bottom line is, you don't want to just start taking melatonin because you think it's going to be protective. You don't want to just start taking, especially large doses of vitamins. Really talk to your doctor. But there's a lot of research ongoing to really understand which of these medications, over-the-counters, vitamins, do any of them actually have effect against COVID. And at this point, none of them have been shown to have effect against COVID. But there is research like this ongoing, and certainly a lot of scientists working hard to continue to look for therapeutics. We do not, as a reminder, have a cure for COVID. And in fact, very few medications that have been gotten even that FDA emergency use authorization, much less approved. But just like for the vaccine, a lot of work is ongoing there. Okay. So Keely at Steve Keeleman 1 from Twitter says, on November 17, the city's top doctor, I presume that's me, said 1 in 15 people in Chicago have COVID. Is this correct? Not sure if my numbers are right, but I have between 30 and 60,000 active cases in Chicago. Are there really 2 to 4 times as many undiagnosed positives in the city? Yeah, really good question. So let's talk about those numbers. And you're right that last week we shared out that in our estimate, as many as 1 in 15 Chicagoans could have active COVID, meaning infectious with COVID right now. So where did that number come from? We look at not just how many people have ever had COVID in Chicago, which is almost 150,000 people have now been diagnosed with COVID. We will pass that 150,000 mark today. We look at how many of those people have been diagnosed with COVID in the last 14 days. You're infectious for 10 days, but we know the last 3 days also have to be asymptomatic. So we use the 14 days as an estimate. We'll use 30 days if you're hospitalized. But the bottom line is that almost 1 in 5 of the people ever diagnosed with COVID in the city of Chicago, were diagnosed in the last 14 days when we ran this analysis. And that meant that, as you know, there's at least 25,000 or so diagnosed cases of COVID here in Chicago in the last, 14 days, so during the time where they're potentially spreading COVID. Our estimate is not just that there are 2 to 4 times, but there are probably 5 to 7 times as many people in Chicago who have COVID as are actually diagnosed. And that's based on some estimates around the country, around the world, looking at things like serology testing, where we know, because right now about 5%, 1 in 5 Chicagoans have been diagnosed with COVID. But we think it's probably more like 5 times that, perhaps 25% of Chicagoans may have actually had COVID. And some of that is based on what our mortality numbers have looked like. Excuse me. We're still between 2 and 3% of Chicagoans who have been infected have died. We know that COVID does not have a 2 to 3% mortality, and we use that to estimate. We also look at what the serology estimates have been like here in Chicago. So across the whole country, the estimate is between 5 and 10 times the number of people likely have COVID as have been diagnosed, and we think we're on the lower end here because testing access has been good. So if you take about 25,000 people, give or take, with active COVID, you multiply that by 5 to 7 times, and then you divide that by 2.7 million people. That is between 1 in 15 and about 1 in 21 Chicagoans with active COVID right now. So we did not, unfortunately, just make that number up, and that is why the risk is so high of gathering right now, right? If 1 in 15 Chicagoans is having COVID, you've got 15 people together for Thanksgiving, right? Chances are good one of those people has COVID. And, if you've got 10 people together, it's like a, 66%, 2/3 chance that somebody potentially has COVID in a statistical way. So that is where that number came from. Okay, some more vaccine questions coming up here. Lots of things. Okay, so Juan Rangel on Facebook is asking, would distribution be halted if people who have the vaccine begin to experience adverse effects? Yeah, so this points to this vaccine adverse event reporting system, or VAERS it's called. There is a robust system that will be set up to follow people who get any of the COVID vaccines. People will get information about how to report any problems or symptoms that they have. We'll be setting up surveillance, meaning data monitoring behind the scenes in case there are people who get sick. There are people, because when you give a vaccine very broadly, there are things that will happen to people that will not be related to the vaccine, right? We will have people who will have a heart attack. And will that be related to vaccine? Will that not? You need to follow, across sort of all of the hundreds of thousands and eventually millions of people to look at the things that may happen to people and to understand if there's any patterns that may be associated with the vaccine. Again, the trial data looks really good on this, but we've got to see the formal data. If they're, in the unlikely event, we did see especially serious adverse events that turned out to look like they were associated with the vaccine. Yes, that is a setting in which, the vaccine could be paused, could be halted. But and that has happened before. That is part of our safety process in vaccines, or even if there is a rare side effect, if it's potentially linked, you would put pause on this even after the fact. Of course, the top line here is that nobody, including the vaccine manufacturers, has any goal of approving a vaccine that is not safe, first and foremost. And our bar there is very high because you're giving vaccine to people who are well, right? It's different than the drugs that you're giving to people who are sick with COVID, and there's some risk benefit there. So we have a very high barrier, but we will absolutely be following up people after they get any of the COVID vaccines, just as we do actually people who get other vaccines, and continue to report out even after approval. And I'm feeling really good about the way this is looking, but absolutely will be monitoring in that after approval way as well. Okay, we are coming up on time already. Maybe we'll take this last question. Tony DeJanic Nicholas on Facebook is asking, when will the vaccine be distributed? The $1 million question. I don't know for sure, because the first thing again that has to happen is the FDA needs to give it an emergency use authorization. That could come as soon as the December 10 meeting. Don't know for sure, but that it sounds like is the earliest it could happen. If the FDA gives an emergency use authorization, the CDC then meets, and specifically a body called ACIP, which is the Advisory Committee on Immunization Practices, which again is a non-governmental group of scientists that actually makes the recommendation to administer the vaccine. And assuming that FDA approves it, and then CDC and ACIP, they've also pledged to meet within just 24 to 48 hours and have a finding out very quickly. We are planning here to potentially be putting vaccine, in arms of healthcare workers in hospitals who sign up to get the vaccine by mid-December. That is not a guarantee. We need to see what the FDA and the CDC say first, but we are planning for the potential for vaccine in mid to late December here, and that's really exciting. Of course, there's a lot of work behind this, and that is just the beginning, right? Healthcare workers, long-term care facilities. We're not talking about the general public getting vaccine availability for a number of months still, and probably springtime before we have widespread vaccine availability. But I'm really hopeful that if everything comes through, if the safety and efficacy data looks good, and we will be looking at that closely, sharing that out. We've got a advisory group of scientists who will be looking at that with us. You'll be hearing a lot after a vaccine is approved, whenever a vaccine gets that emergency use authorization, about what that means next. But I think it's likely, based on what we're seeing now, that we may have our first vaccine before the new year in Chicago, which is exciting. And I think that is maybe some good news to sort of end on. We have some other good news. First, just as a reminder that here in Chicago, we have suspended electric and gas disconnections, recognizing again that there are a lot of people in strained economic circumstances because of COVID and otherwise, and we're heading into the cold. People need power and gas for heat. So there's information online, you can Google it, but you can also reach to ComEd or People's Gas to get financial assistance or get reconnected. So reach out if you or anybody you know has that problem. Also, just as a reminder, certainly a lot of the focus for Thanksgiving has been on Thursday, but Friday is typically Black Friday, and we are encouraging you to think virtually for any shopping you want to do there. And specifically, we're trying to think about this play on words with Black Friday, which is usually when retailers move from the red into the black in in the year as a way to support more than 500 Black-owned businesses here in Chicago. So hashtag is Black Shop Friday. You can go to blackshopfriday.com to see more opportunities there. And certainly, I encourage you to check that out and think about that way of shopping. But otherwise, please do not, if part of your Thanksgiving traditions is that crowding into stores for sales on Friday, please, that's not a year, honestly, for that this year. Do some of that virtually and think about supporting your local businesses here and smaller businesses would be an ask. And along those lines, we are still doing our hashtag Takeout Chicago Challenge. Remember that if you get takeout from 10 bars and restaurants before December 15th, you can put your entry in at chicago.gov/takeout, and you'll be entered in sort of a drawing to win things like behind-the-scenes tours of Soldier Field, behind-the-scenes tours of some of our museums later, once we're more past COVID. I am certainly participating in this. I am, for my own Thanksgiving meal, I am getting some Takeout Chicago from some Chicago restaurants that went in together. So I'm getting like turkey from one and pie from one and sides from one. And I'll be bringing that home and celebrating at home. So happy Thanksgiving to everybody. Reminder that a Zoom Thanksgiving is better than an ICU Christmas. So please, please be careful. Do the right thing. I want to protect the little bit of progress we are seeing here in Chicago. And if we pretend that COVID is not here, even this week, we will lose that progress and we will be in a really bad situation, particularly related to protecting our healthcare system, hospitalizations and deaths. So it's not too late to think twice. It's not too late to change some of those Thanksgiving plans if you haven't already had that hard conversation. I love Thanksgiving. It is hard to make these decisions, but it is the right decision for you, your family, and Chicago. So happy Thanksgiving. Let's give thanks that there's some glimmer of hope there on the vaccine front too. But in the meantime, keep doing the things that you know work. Be safe, Chicago. We won't be on Thanksgiving. We'll be back live next Tuesday to take your questions. Be safe.